Hello, my name is Molly. My partners Madison, Cheryl, Erin, and I are nursing students from the class of 2022. We conducted a literature search based on our PICO question, in pregnant women, what is the impact of prenatal education on their perception and experience of labor? The results provide significant evidence that education for pregnant women actually reduces anxiety and increases confidence before entering motherhood and experiencing labor themselves. With this, we have created a proposed research experiment to be conducted at a women's health clinic.
We have created the following experiment in hypothetical terms using our clinic, Lady Owl's Health Clinic. Our coworkers at the health clinic remain uneducated on the research to support prenatal education classes. We will begin by disseminating the evidence throughout the clinic to nurses, which make up about 75% of our staff, and doctors, about 10% of our staff, each day of the week. Evidence will be disseminated through brief conversations, including but not limited to hallway conversation, as well as educational posters in the lunch and break room.
The objective of our proposed study is to evaluate the overall impact that prenatal education has on pregnant women's confidence and anxiety. This will be evaluated both before the class, after the class, and after birth. Nursing care is largely based on identifying nursing diagnoses related to one's health status. The evidence from our literature search supports a couple main diagnoses for pregnant women, which are knowledge deficit and risk for anxiety.
With a limited budget for research at the clinic, we plan to use our partnerships with other health clinics and hospitals, as well as Westfield State's nursing department, to ask for donations of supplies. With a lack of physical materials, we also plan to use the TV screen in the clinic to provide a digital display as a visual representation of any supplies we are unable to obtain due to budgeting purposes. Nurses and doctors at the clinic may also donate their time to hand-make supplies or items in one's house to represent any supplies we may need.
With support of the clinic's director, the research study may be conducted at the clinic during donated time of 3 to 4 Saturdays outside of our regular business hours. Nurses and doctors of the clinic who are interested in the research may also donate their time to help with planning and implementing the study. Therefore, there will be no need to budget for paying the healthcare workers who are doing the teaching. A small fee for the class may provide the limited budget for necessary supplies.
Our methods are as follows. We will evaluate the efficacy of the class by providing a questionnaire for expectant mothers to evaluate their anxieties and preparedness towards childbirth. This questionnaire will ask mothers about several factors affecting them, such as stress level, education level, specific worries, and knowledge gaps. Using their responses, we will be able to understand how to improve their overall experience so that they will be more prepared and less anxious for childbirth. We later plan to reevaluate these same emotional factors with the standard questionnaire both after the class and post-childbirth. This is to evaluate if outcomes improve during childbirth as a result of partaking in this course. This will help us determine how effective the class was for expectant mothers and how beneficial it may be to use for others in the future.
The Roy Adaptation Model is a model of how we plan to provide the education in the class and identify key points to relate the education directly to any identified knowledge gaps. The questionnaire will be able to help identify areas where women feel less confident and more anxious regarding labor. Using this information, we can identify key points for the curriculum of the class. The Johns Hopkins model that we mentioned in our poster includes 3 main phases that we focus on here with our project. This includes practice question, which is our original PICO question from our literature search. The second phase is finding evidence, which we found to support effectiveness of the education. And the third phase is implementing evidence, which was done through the proposed prenatal education class.
The implications of implementing this program could be that with greater prenatal education that pregnant women receive prior to birth, there will be an increase in maternal confidence before and after giving birth, as well as a decrease in anxiety related to the labor process. This implies that access to and maternal participation in prenatal education will likely lead to greater psychosocial outcomes for mothers of newborns. Anxiety reduction is also known to be directly related to better health outcomes, which is why nursing interventions to reduce anxiety are implemented in practice and taught to nursing students.
In conclusion, after conducting our literature search, We have confidence in this research study and that it can be used to improve the future of prenatal education, leading to improved health outcomes for new mothers.
As future nurses, it is our duty to provide care to patients that make them feel safe and comfortable, and by offering education, we can do just that.